Preparing for Elders, a training to foster confidence and safety. Aging is a normal process. It's a part of life and everyone experiences it. This slide shows Erikson's stages of development, and today we're going to be talking about the last and final stage, stage 8, ego integrity versus despair. This is for people around the age of 65 and older, and the basic virtue is of wisdom. To talk more about this, the stage occurs around the age of 65 and older when we begin to become senior citizens. This time period is characterized by retirement and contemplation. Erikson described ego integrity as the acceptance of one's own and only life cycle as something that had to be. Success leads to content and wholeness, whereas not accomplishing life goals will often lead to guilt, depression, and hopelessness. Wise people experience both ego integrity and despair. There is always a balance to be had. The kisses of age. The changes we see, feel, and experience to and within ourselves as a result of the progression of time. These are the changes in integumentary system, which is the skin, the changes in skeletal, musculoskeletal structure, the changes in metabolism. There are changes that we see in our senses, including our hearing and our ability to see, especially and particularly far away as we age. We have changes in cardiovascular system, and there's changes in our internal organ systems as well. There's also the concept of dignity when we talk about getting older. And there's this concept of ageism that's really rather inappropriate and disrespectful, but it's the belief that as we become older, we become no longer useful. Things that contribute to people feeling insufficient as they age include the informal use of their name, being called dear and cutie, their inability to perform their activities of daily living by themselves as they once were able to. This includes showering and bathing and toileting themselves. The inability to perform their instrumental activities of daily living, being able to manage their own checking and banking accounts. These things really affect everything that really relates to dignity. So in respect to dignity, we can really bridge this gap and really make sure that we treat our elder people with dignity by making sure we know how to properly communicate with them. Seniors are knowledgeable people who have something to contribute to society and the wisdom they've gained from their life histories. Communication is key. Respect is in listening to the individual. Be polite and understand that aging is not easy. Considerations for those hard of hearing. When we're trying to communicate with people who are a little bit older, it might be hard for them to hear us. So things we should be considering and doing include standing in front of the senior to speak with them. Stand directly in front so they can see you. Do not block your face or mouth. Speak slowly and clearly, and emphasize the words that are spoken. Don't choose words that have too many syllables or pronunciation or too difficult. Spondee is it's a metric thing in poetry that really just, it's a 2-syllable word. And people have an easier time understanding when you communicate with them, especially when they're hard of hearing, spondees and a limit of those 2-syllable words. So something to consider. Depending on the past lives of our members, the elder's ability to perform their own ADLs may decrease. This includes the ability to change clothing, shoes, or briefs, the ability to change positions and ambulate independently, and the ability to take care of showering and personal hygiene. Areas that may be affected due to reduced functional mobility include the following: skin integrity, musculoskeletal changes, nutritional status, and decreased socialization. Skin breakdown is one of the many problems that an elder person may experience when they may need to rely on a caregiver to help perform ADLs and IADLs. Things that cause skin breakdown in particular include repositioning the elder or member infrequently, forgetting to turn every 2 hours or sooner, exposure to a used brief, waiting for assistance with toileting, not checking on lower extremities at frequent periods, often daily, and not partaking in daily foot care. For the more seasoned member, factors like incontinence, disease processes, and impaired mobility can affect the entire integumentary system. An impaired integumentary system, or the skin, is identified through skin breaks, tears, dry skin, fungal infections, rashes, hair growth and the lack of it, nail infections, redness, irritation, drainage, warmth to touch, and ulcerations and bruising. So our goal is to try and fortify the skin. So we're going to be trying to provide a balanced diet and to help our elders stay hydrated. Check skin daily, especially over all bony prominences. Do not use powders or harsh soaps, and don't scrub the skin. Do not take baths every day. This tends to dry out the skin. Clean areas under skin folds and breast and dry thoroughly, and use moisturizing cream and skin protectants daily. Some musculoskeletal changes seen in the elderly includes osteoarthritis. We do tend to see that, especially if their lives and their hobbies kind of dictated what they did for most of the time. Rheumatoid arthritis, we see that. Some joint stiffening and connective tissue thinning, we often see that, and the more that we see that will lead to the OA and the RA. The loss of muscle mass actually occurs because of the reduced hormone production as we grow older. So there are some changes that happen as we age. Considerations for the more mobile senior: obtain adaptive devices and have them serviced regularly. Maintain an active lifestyle. Encourage socialization. Get enough vitamin D and calcium. And I just wanted to also throw in there that petite Caucasian and Asian women are at a higher risk of falling under the osteoporosis category. And getting enough vitamin D and calcium will help prevent little tiny compression fractures, especially along the spine as we age. The fear of falling. There's a great fear in falling for the aging population for several reasons. The skeletal changes, metabolic changes, including the insulin resistance that is seen, orthostatic blood pressure changes, and lower levels of hormones. We have gait changes, vision and hearing impairments, and medication regime actually becomes a problem as we age. We often see orthostatic blood pressure happening in relation because of the medications that the population is on. So something to consider. Reducing the risk of falls. Keep active. Wear proper fitting, non-skid shoes. Remove home hazards, which there's a whole list we'll see on the next slide. Illuminate the entire living space. Don't live in the dark. Keep everything lighted and nice and bright so we can see. Review medications with your doctor and use adaptive devices. Don't just have your cane on a wall. Have it nearby and help to have it nearby your member so that they can actually use it. This is a list of things that can be done in order to have a safe and fall-free home. Remove boxes, newspapers, electrical cords, and phone cords from walkways. Move coffee tables, magazine racks, and plant stands from high-traffic areas. Secure loose rugs with double-faced tape. Tax or slip-resistant backing. Or remove loose rugs from your home. Get rid of those scatter rugs. We don't need them. They are just as cute as they are. They really are just a huge hazard to the older person. Repair loose wooden floorboards and carpeting right away. Store clothing, dishes, food, and other necessities within easy reach. And immediately clean spilled liquids, grease, or food. Use non-slip mats in your bathtub or shower. Use a bath seat, which allows you to sit while showering. Emotional well-being determines health outcomes. It's something that's being studied more and more frequently as we see people living within their communities. And we can see that the more socialization they have, the better and the more higher quality of life that they also have. The health outcomes increase as well. So when we try to address a person, we need to address them as a whole and not just as the diseases that they have, but what are the risk factors of depression and other issues as they age, because they are a population that has risk factors for depression, as we'll see on the next slide. Some signs of mental health deterioration is depression, withdrawal, isolation, increased need for sleep, an increased report of pain or repetitive health concerns, and physical capabilities. A decrease in that would indicate that there might be some issues with depression or loneliness or feelings of inadequacy, and it should be addressed. Ways to reduce and mitigate this depression is to encourage social connection and to find new purpose for them. Help them to stay active and allow them some alone time, and to seek preventative health care routinely. A lifetime of experience. This population was a part of many historical and influential events and movements. Their wide range of life experiences and cultural backgrounds often influence their perception of illness, willingness to adhere to medical regimens, and ability to communicate effectively with healthcare providers. The key to any population is to listen without judgment. Caring for Elders Quiz. The following slide contains a quick quiz to assess your level of understanding. Please answer the following questions.